Ed Markey of Massachusetts. He's a key member of the Foreign Relations Committee. Senator, thanks for joining us. First of all, do you support the compromise worked out by Lamar Alexander and Patty Murray?
Yes, I do. I think that it is a fair compromise. I congratulate Senator Alexander and Senator Murray for their brilliant work to solve a problem that could have led to the collapse of insurance markets all across the country, could have led to a loss of coverage for cancer, diabetes, for addiction coverage all across the country. So I think they've come to a wise, sensible, and bipartisan resolution of the issue.
Would they have been able to reach this compromise without President Trump's halting those subsidies last Friday?
I think in many ways that was the precipitating moment, because the president was basically saying that he did not care if the insurance markets collapsed. He did not care if the premiums rose by 8%, 15%, 20% and more all across the United States of America. So I think that's really what focused the attention then of Patty Murray, Lamar Alexander, and many others on this issue. And I think now we have a common sense solution to the problem. And the president is now signaling, thank God, that rather than sabotaging health care in the country, he's going to try to find a way to sign this bill and to make sure that there is some stability in the healthcare marketplace.
Before there's a bill, it's got to pass the Senate, pass the House, so it's certainly not yet a done deal. But you think there was some strategy in the president's effort last Friday to derail these subsidies, that he thought if he did that, it could lead to a bipartisan compromise?
I think you're giving him a level of strategic credit that is beyond my power to be able to grant to him. But nonetheless, whether it's by luck, design, or inadvertence, that is what has happened today. And as long as the president says at the end of the day that he can support it, that he can sign it, then ultimately that's a good thing for the American people.
But won't the same disagreements over the future of healthcare remain 2 years down the road? This is a 2-year deal, a 2-year compromise. Are you just kicking the can down the road?
There's no question that the far-right Republicans in our country have declared war on the Affordable Care Act, as they have, by the way, on Medicare and Medicaid, which is what we see in their budget proposal this week. They still harbor an ancient animosity towards each one of those bills: Social Security, Medicare, Medicaid, and the Affordable Care Act, and they want to leave them as debt-soaked relics of the programs which they are today. So you are right, they are not going away. We will revisit this battle over and over again, and as early as this week, as they try to take a machete to Medicaid and to Medicare in their budget.
If this compromise deal is passed in the Senate and the House, signed by the president, presumably would take a lot of pressure off many Republicans in next year's midterm elections. Some of your fellow Democrats suggest that could be a political mistake. Do you agree?
Well, again, helping the American people is good policy, and good policy is always good politics. But without question, the Republicans were coming to realize that they were going to be blamed for the sabotage of the health care insurance marketplace, and that as premiums rose, they were going to have to bear the political responsibility for it in the 2018 election cycle. But that's no reason why Democrats shouldn't try to work with them in order to solve the problem, and that's what's happening this week, with our fingers crossed that it can pass the entire Senate and the House of Representatives.
Because here's another issue potentially down the road. Let's say you pass it, it's signed by the president. The president repeatedly says, and he said it again today, that Republicans will have the votes to repeal and replace Obamacare maybe in March or April in the spring of next year. Should Democrats make this deal with Republicans, knowing that the president might be aiming for a full repeal next spring?
Well, they do not have the votes right now. That's why John McCain's thumbs down was so important on that repeal act earlier in the summer. And there's no sure thing that they will ever have the votes to fully repeal the Affordable Care Act. The more that they battle to try to repeal it is the higher the favorability of the Affordable Care Act has been in our country, because people now understand much more fully how badly their families are harmed if Medicaid, if a machete is taken to Medicaid, if hundreds of billions of dollars are taken away to give tax breaks to the wealthiest 1% in our country. That did not poll well in August of 2017. It won't poll well in March of 2018 either, even closer to the election day.
Do you have concerns, Senator, about the deployment of U.S. Army Special Forces, the quality of the intelligence which they're relying on in Niger, for example, and elsewhere in Africa?
Well, I'm glad to hear that General Mattis wants there to be an inquiry into what happened, what the circumstances were, what kind of intelligence was available to our military personnel in that situation, and what happened in the aftermath of the incidents. I think the American people will want to have these answers, so I'm glad that General Mattis is making it clear that he believes that it is, in fact, important for that kind of an investigation to take place.
Do you understand what the U.S. mission there is, why American troops are deployed in Niger right now?
Well, I don't know the specifics of this one mission, but I know that not only in Niger, but in other countries, at least support American personnel are there to help in the global fight against ISIS, regardless of what name they have in any individual country. But I have no way of knowing what the circumstances were in this particular instance.
What message, Senator, does it send when President Trump accuses his predecessors, including President Obama, of not calling the families of fallen soldiers?
Well, in fact, the question that was asked of President Trump was, what is the situation going on in Niger with our American personnel? That was the question that the press was asking after 2 weeks of no response from the president or the White House. It had nothing to do with a call to the families of the fallen. And so now, today, we see that in fact there's going to be an investigation into what happened. So all I can say is I know President Obama. I was actually with President Obama, with the First Lady, with the Vice President and the Second Lady when they were at Andrews Air Force Base with the families of the Benghazi fallen Americans. And I can tell you it was a very powerful scene to see the President and Vice President trying to convey the condolences of the American people to those families, and I hope that we can do the same for the families of those who have fallen in Niger. I think that's really what we should be talking about.
Senator Ed Markey of Massachusetts, thanks very much.
You're welcome.